Hi everybody, my name is Dr. Carol Barron. I'm an Associate Professor here in DCU and I'm the Programme Chair for the Masters in Child and Family Health and Wellbeing. I do have a presentation, but I think you might be PowerPointed to death, so I can tell you about it instead. It's the Masters in Child and Family Health and Wellbeing. It's a level 9 programme offered from the School of Nursing, Psychotherapy and Community Health here in DCU. It's very much an interdisciplinary programme and it's designed that way to enable you to study on promoting holistic child and family health and well-being. And you cover a lot of the contemporary societal challenges that are facing children, young people and their families from a very strong interdisciplinary perspective. The programme is 2 years part-time and it's a blended programme online. So there are 6 face-to-face days in DCU over the 2 years. And then the classes are on Tuesdays and Thursday evenings from 6 to 8 during semester time. Just to give you an idea of what you'd cover and the layout of the programme, in semester 1, you would cover core scaffolding modules, what we would call. So there'd be a module on children's rights. So talk about the United Nations Convention on the Rights of the Child and how the Ombudsman for Children's Office, the Children's Rights Alliance and all fit into that, and linking it back to your different workplaces because we get people from allied healthcare professionals, nursing, education, early years, social work, etc. on the programme. The second module in semester 1 then is on child and family focused care and well-being. So that's looking at family relationships, the well-being of families, well-being of children. You also cover a research module in semester 1 and in semester 2. That's a year-long module, and it tends to be, I know some of you research, but it tends to be divided up into qualitative methods one semester and quantitative research methodologies in the second semester. Then in the second semester of year 1, you have modules on global child health and health inequalities. So what are the main concerns we have for children, their health and well-being and families at a national and a global level? And the second core module then will be contemporary issues in child and adolescent mental health, which again is hugely relevant in today's society. And we will bring in key experts for all of those modules in year 1 and 2, but they're all run from here in DCU. Then in year 2, and all of the assessment is continuous assessment. There's no examinations, it's all CA. And that takes the form of assignments, group presentations, posters, debates. There's a multitude of different forms of assessments in there. So there's something there that will suit you if something else doesn't. Then in semester 1 of year 2, you have another core module, which is community-based care for children and families, health and well-being. So that's community-based care and services out there, because an awful lot of services for children, they're predominantly community-based. So that's the focus on that module. You also, in semester 1 of year 2, start your research dissertation. And at the end, at the end of year 1, you will do a research proposal as part of your research methods module. So it's your opportunity to pick a particular area of interest to your work environment that you're interested in knowing more about. And they have to be low risk projects, but once they are, you will go through ethical approval here through the school or through an outside agency, depending on where you work. And then you get to conduct your own research, which you are supervised constantly throughout by a specialist in child health. And that runs from semester 1 and semester 2. And the submission for that would be in the summer, the June or July of year 2 of the programme. So I realise that we're way behind time. So that's the Masters in Child Health and Family Wellbeing in a very abbreviated form to try and get us back on time. I'm perfectly happy to send on Margaret the slides to share if anybody's interested in them. I just wanted to be quick because I knew you were behind time. Okay. If anybody's got any particular questions they want to put into the chat for me, I'm more than happy to answer them. Or you can email me individually at carol.barron@dcu.ie. I've had a lot of contacts. We try to keep the numbers small on the program, down to less than 15, but you will share the research methods module and a dissertation module with another master's program. So you get a really good group dynamics in. They're always out having dinner and other things together. So you'll have your own core group. And then for 2 of the modules across the 2 years, you're in with a larger group. But by large, I do not mean like 100. I mean 30, 35 and smaller numbers. So we try to keep it as individualized as we can throughout the program for you. Okay. Bye, everybody. Enjoy the rest of your day. Thank you. Bye.